Kelly, and this is She's a Full-On Monet. A lot of you guys are always asking about my skincare routine and complimenting me on my skin. I don't honestly have like great secrets other than I stay out of the sun. And Dr. Kappel here, she takes care of my skin for me. I don't wear a lot of makeup on days that I'm not shooting or having special events. I try to give my skin a break from the heavy makeup. And Dr. Kappel makes that possible, making my skin look great makeup free. I do have a concern today. I have a little age spot here that I'm hoping she can help address for me. But I wanted you guys all to meet her and to kind of see the process today.
Thank you.
Yeah. So that's what we're doing today. Hopefully it's not too painful.
So this is called a solar lentigo, and it's just basically a sunspot that we get. I don't even like to say with age because this can even occur in our 20s and 30s, and you're beautiful and you're forever young. But it just happens with sun exposure over the years. Another name for it is called a macular seborrheic keratosis. So dermatologists like to have long, lengthy names for things that are pretty simple. It's just a benign growth, which means it's harmless. There's no medical concern. It's just more of a cosmetic issue. So there's a few ways that we can tackle this. So lasers can definitely improve the cosmetics of this by fading it away. Usually it's in one treatment, but sometimes it'll be more than one treatment. Say it's 2 or 3, usually spaced about a month apart. And then after the treatment, we want to make sure that you wear your sunscreen to protect it from happening again. So there's a couple different lasers, and it's really important to go to a board certified either dermatologist or plastic surgeon. Thank you. Lots of school to learn how to use these lasers because the physics behind the mechanics of these devices are very elegant, and it takes a trained eye and skill level to achieve certain goals. So there's a number of ways that we could address it through lasers. So starting with something called Clear and Brilliant Permea, which we could just basically do a couple passes over that area. There's no downtime. It's a little bit more superficial, the laser, so it's not as aggressive. So the good thing about that is that there's no downtime, but the downside may be that you may need more than one treatment because it's a little bit, I don't want to say wimpier laser, but it's less strong. There's also something called a Q-switched alexandrite laser, and that's more of a spot treatment laser, and it pretty much just gives like a little scabbed look to the lesion or to the brown spot that kind of just sloughs off over time. So there's about 1 week of downtime where you have a little bit of crusting or scabbing. You can cover it up with makeup, but sometimes when you put concealer over a scab, how can it look worse? So I would just make sure you don't have any social events or events to go to during that week of healing. But usually that's a one and done treatment. The less aggressive way that we can treat this is just by using creams, so brightening agents like hydroquinones or non-hydroquinone skin brighteners, lighteners, seaweed extracts. There's a lot of different over-the-counter and medical grade topicals we can use, meaning just creams that are on the skin. Sometimes those are less aggressive, meaning their response isn't as impressive as a laser outcome would be. But the upside of that is that you kind of can titrate your way and not really have any downtime. It may take months for it to fade. So there's a lot of different ways to go about doing this. And just being with a trained expert is important to make sure that you don't scar or you don't have a bad outcome, and also that you 100% treat the lesion. And I always like to say, because at the end of the day, as a dermatologist, anytime you do have a pigmented lesion like this, she did the right thing with coming in and having it evaluated, because you want to make sure that it is something benign, because pigmented lesions aren't something that we mess around with. Melanoma is a very aggressive skin cancer. I'm not concerned with this at all. Yeah, we always tell patients to look for the A, B, C, Ds. A is asymmetry, B is border irregularity, C is color variation, and D is diameter. So anything bigger than 6 millimeters, which is like the size of a pencil eraser, is kind of warrants a biopsy. We usually like to test it, look at it under the microscope, but just clinically looking at this, as a trained eye, I can tell you that it's going to be nothing. We could just zap it with a little laser and have it go away.
Okay, so one thing that I did want to mention is that Dr. Kappel, I've been seeing Dr. Kappel for a few years now. So she does know my skin, and she has been kind of watching this spot. So we did know already that it wasn't growing. There was nothing to be concerned about. I had discussed it with her previous appointments. And we had tried some of the topical treatments, and I did not get the results that I wanted. So she was sharing with you guys all the options. But also, I really wanted to say that it's important to find a dermatologist that you feel comfortable with sharing your concerns and that you can see on a regular basis, which sometimes I know that's not the case at med spas or home parties and things like that, where people do forms of dermatological stuff. I'm not a scientist, I don't know what I'm saying. But it's important because everybody's skin is so unique and individual. And I have like really sensitive, thin skin. Even things that you're not supposed to have a reaction to, or you're not supposed to have downtime, or not bruising. I will bruise. I will get like a lump. I have like that 1% reaction to things. And she knows that from having treated me for so long. Yeah. So we work out a treatment plan together, she knowing my particular concerns. So I think that's really important, because if I was to go just to some random place that was having a special on a billboard or something, they wouldn't know my skin, and I could end up with a bad result just because maybe I didn't advocate for myself, or I wasn't listened to, or, doctors it takes time to get to know people's particular concerns in skin. So I think it's really important that everybody find a dermatologist that can get to know you, get to know your skin, you build a relationship with, especially as we have concerns about things like sunspots, skin cancer, because things show up and change over time. So that requires kind of
like a customized approach. So each individual patient has a different skin type, different ethnicity, different reactions to different lasers or procedures. So you always want a customized, individualized plan for each individual patient. And that just takes time and experience and education and training to learn how to do that. It's not all skin's created equal. So if you go to like a med spa maybe and there's a certain laser there, you're not going to do the same laser on everyone. You're going to titrate the settings. You're going to push the limits of the laser safely and effectively by looking at the endpoints. You don't just use a drop-down menu as a cookie cutter kind of approach to each individual patient. And I think that that's the problem with a lot of med spas, because as dermatologists, we're the ones who see the bad side of bad outcomes sometimes when that happens. And I just feel like it needs to be a customized treatment plan, not just the same one for everyone, because it does make a difference knowing the skin type and how each individual patient is going to react.
Okay, so she's getting ready to apply the numbing cream, and this will keep me from feeling the laser, which, while it's not incredibly painful, it is, as I've been told, uncomfortable. So the numbing cream will make it less uncomfortable. So, okay, here we go.
Feel?
Good. That was actually relaxing. That was like a face massage.
Yes, I always try to pamper our patients before you start to feel it.
I don't feel anything yet. It'll take almost an hour, but it does feel warm, and there is a little bit of you can feel it's starting to do its thing, but
kind of kick in.
Yeah. It's not a bad sensation. It's just like I have like thick warm stuff on my face.
Yeah, it's like warm honey.
Yeah, kind of. Yeah, that's a good analogy. Okay, so over the next hour, my face will get more and more numb.
Exactly, and you're not going to feel it, but you're still able to do everything that you would normally do in terms of animating, but it's just going to feel a little bit more dull in sensation.
Okay, all right.
So Kelly, we're going to be doing the Clear and Brilliant laser today. So this is a really superficial laser. It's almost like a Fraxel facial because it's very superficial. And over time, it'll help even out the pigment and the texture of your skin. It'll make your pore size smaller, and it'll stimulate collagen. So that's the true meaning of anti-aging, because we lose collagen each decade. So if we do little things along the way that don't really have much downtime, it's kind of like dumbbells for the skin. Going to the gym and working out, you're collagen banking and adding collagen. So when you lose collagen, you're basically not aging. So that's kind of why we recommend it. There's little to no downtime. You'll maybe be a little bit red about an hour after the procedure, but then after that, no one will know anything. But then you can go out, have any social event, cover it up with some tinted sunscreen, some powder, no one will even know. It's a great procedure for people who are very busy or in the public eye like you.
Perfect.
So we can select a level. I'm going to start off with the highest level, which is a level 3. And we're going to do about 4 or 5 passes. If it's too much or if it feels too uncomfortable, which it shouldn't, I can always titrate it down. But we start on the highest level to see how much you can tolerate.
Yeah, I feel pretty numb, but I'll let you know.
Okay, okay, good. I'm going to put your eye shields on also.
Okay.
So these eye shields protect your eyes from the laser. They don't have any sticky material on the inside, so they're engineered for people with lash extensions, or you don't want to disrupt your lashes.
Yeah,
with your natural ones.
Thank
of course,
you.
we got you. So yeah, just close your eyes, and your eyes will be protected without any harm being done to your beautiful lashes. You feel okay?
Mm-hmm.
Okay, good. So we'll go ahead and start the procedure. It just has to take a minute to calibrate. Okay, so the first couple passes is going to get used to your skin, and then it's going to start going. Okay. Do you feel that?
I mean, I felt the tip of it, but there's no uncomfortableness.
Okay, good. So if you were to rate it on a pain scale, like 10 being the worst pain ever, 1 being not too bad, how would you rate it?
Less than 1. Like, it literally feels like you're writing on me with a pencil.
Perfect. Yeah, so without the numbing medication, it's a little bit more spicy, as we say, or uncomfortable, but you got this, you're doing great. Tomorrow, like I said, it'll feel almost like a little sandpaper. Basically, poking thousands of little microscopic holes, and they all kind of scab over, and then they manifest as little scabs on the face, which can kind of give like a sandpapery look and feel. But then the day after that, it kind of slough off, and it'll be a nice, smooth, radiant skin underneath. And that's what we're going for. So, how are you feeling?
Good.
So we're going to hold this, then we're doing a couple extra CLC passes on this little brown spot here, okay? Good.
It's like I'm letting the grandkids just draw on my face, and I fell asleep and they're just coloring my face in.
Good. And when we do the passes, we kind of go different vectors. So we go on this like an X, Y, Z axis to make sure we get full coverage of the brown spot. To make him go away. Okay. You feeling okay, Scott?
Yep.
Good. This helps with forming those little lip lines, which you don't have and you never will, because you do things like this. Keep those guys away. And then after the laser procedure, we're going to put a couple serums on you. And we'll put a growth factor on you and a brightening agent on you. And it's almost like a drug delivery. So this laser is poking little microscopic, zones of treatment into the skin. So it's going to pass through the epidermis, which is the upper layer of the skin, down into the dermis, which is the lower level where all the collagen is. And when you put products on right after the laser, it's like a drug delivery. So your skin just really soaks it up because it goes directly down to the deeper layers of the skin.
Oh, that makes sense.
Yeah. You okay?
Mm-hmm.
You're doing great. Does it feel hot yet?
No.
You with me still? Your
Yeah.
skin looks good.
I'm excited.
Yeah, your skin looks beautiful. And like we're talking about that, doing little things like this along the way, the technology has come so far that the days of like faceless and doing big dramatic procedures are going to be a thing of the past now that the technology is so great to kind of prevent and maintain. You feeling okay?
Yeah.
So I'm also right at the very end, I'm going to do a couple little passes under the eyes too.
Mm-hmm.
So doing a pass under the eyes kind of helps stimulate collagen in that area because the skin under the eyes is so delicate and thin that over time, when we lose collagen, it's a little bit lax or craggy looking.
Yeah,
So
I know exactly what you're talking about, and it bothers me so much.
No, you can even have that, but we'll make sure that that doesn't happen.
But like when you smile and the skin under your eyes kind of like...
Yeah, for sure. It'll help with that for sure. You okay? You're almost done. Small and then go under your eyes and put the serums on, okay?
Okay.
So great. Just have our friend here. our friend the little solar lentigo. Okay, now I'm going to move these a little bit farther on your eyes and really try to do this for the little fine lines of your eyes. You okay?
Yeah.
Perfect. Okay, you are all done. So I'm going to go ahead and put those little serums on. Okay, so we're going to first put some growth factor serum on the skin. So immediately after laser, it has a great drug delivery capacity. So it's almost like a gelatinous but really soothing texture to it. So you can tell us how it feels, but it should be pretty soothing. And these growth factors just stimulate healthy maturation of the keratinocytes, which are the skin cells in our epidermis, at the upper layer of our skin. And it just stimulates collagen synthesis and elastin synthesis, the things that we lose over time, which can cause the skin to become more lax. So by stimulating collagen and elastin and cellular growth and renewal, it'll keep our skin fresh, and it will definitely increase the texture and tone of the skin to be more even. So those are the growth factors. And the next we're going to put on something called melanin. So melanin's a hydroquinone, and actually hydroquinone, sometimes gets a bad rap, but this is a very safe technology. It's highly regulated and goes into the deeper layers and the superficial layers of the skin to help keep the brown spots away and even out the texture and tone of the skin. So for that little sunspot right here, we'll give a little extra TLC to that guy. And this helps treat melasma, chloasma, or just kind of like those brown patches that we get over time, not only from sun exposure, but birth control, pregnancy, breastfeeding, and just UV light, even despite sometimes having sunscreen. So this will kind of just overall increase the tone of the skin. So when we talk about tone, that's more pigmentation. And when you look under the microscope, and the pigmentation, which is melanin, is all in the same level of the skin. It just gives that radiant glow, and that's when people have that glowing skin, because all the melanin in the skin is in the same area. It's not all splotchy and distributed in different vectors. So that's what this cream does. So we're just going to use a little liquid nitrogen just to kind of give a little final boost to this little brown spot here after the laser treatment. It'll just kind of increase the turnover and kind of desquamate that dead skin cells off that are holding on to that pigmentation. So I'm just going to do this for a little extra boost, okay?
Okay, I'm not going to feel anything.
You're numb, so
okay.
Hopefully not, but you let me know if you do feel it. Do you feel anything?
Like a wet Q-tip.
Yeah, okay, good. So it's not painful?
No.
Not too bad? Okay. Little owie?
No, just strange. I mean, I feel it. It's...
Okay. That's it. Voila.
Okay. Okay, so we just finished my whole treatment, and I feel great. I'm still really kind of numb. That should last probably for a little bit longer. But I would say at no point did any of it get above like a 1 out of 10 on the pain scale. So it was very comfortable for me, and I'm kind of a big baby. So I think it was definitely a great experience. I haven't seen it looked in a mirror yet, but hopefully the downtime is minimal to none. And I'll show you guys over the next few days, in my photos, what my face looks like. So, and yeah, I'm sure I'll get a lot of messages from you guys telling me your opinions. Hopefully they're all good.
You did great.
Thank you.
So great.
Thank you so much.
Yeah. She's my poster child to be able to go without makeup.
Yeah, that's the goal, right? I usually just wear like a tinted sunscreen, and
perfect.
That's what I'm hoping to be able to do. Just let my skin just be natural. Just wear sunscreen and
you say fix it, don't cover it.
Yeah.
You don't need to.
Exactly. Thank you.
Great.
Okay, you guys, thank you so much for watching, and we really appreciate it. Hopefully you guys got some great information and some behind the scenes stuff on skincare in general and on this procedure in particular. If you want to find out more about skincare, and I highly suggest you follow. She gives great tips, and if you have any questions, she's always really great about sharing advice with everyone. Her Instagram is Dr. Stephanie Kappel, right?
Yeah, MD. Perfect.
MD, yeah, I can't forget that. And her YouTube channel is called Younger, just Younger. So yeah, definitely give her a follow. She's always sharing really great tips.
Great.
Yeah.
Thank you.